Hello, everyone. Welcome to our weekly live show at Pros and Babes, where we help overwhelmed moms who are in corporate, demanding, competitive, and STEM careers go from that place of chaos to organization and clarity. And today we're bringing a very important health topic to the forefront. So our guest today is Teresa Norris. She's a passionate sexual health specialist with over 16 years of experience. She uses evidence-based communication methods and champions disease prevention strategies. Teresa is an expert on HPV issues, offering forward-thinking programs that inform healthy relationships. Teresa and her team work with healthcare professionals, clinicians, and health systems around the world. She is also a mom, so we will be talking to her about the work she does professionally, her passion for the work, why she started it, and what you can do today to get some information about HPV-related risks and how you can protect you and your children from those risks. So welcome, Teresa. Thank you for joining us.
Oh, thank you for having me. Nice to meet you.
Nice to meet you too. So let's dive right in. I was researching the work you do. Actually, our connection ties back to my roots in Montreal. So it's nice to come full circle with some of my work as a journalist. So tell us why you started the work you're doing, the impact it's had on, Canada and even other countries, and what drives you to pursue the work that you do.
It's a loaded question. So in a nutshell, I started my work from, stemming from a tragedy. I grew up in Toronto and had a best friend, and we started our friendship at the beginning of high school. So we lived all those rites of passage, including having 4 children between the two of us together, being in her wedding. And then my best friend passed away from cervical cancer in a very short period of time of 7 weeks. And back when she passed away, it was in 2001. I should highlight, she passed away on my son's first birthday. So it was an ultra traumatic experience. But back in the day, we didn't understand, what we do today about HPV, and HPV is cervical cancer. And so, if you threw it in a computer and Googled HPV, you'd be hard pressed to find a lot of information. So we fast forward 20 years to today. I can say, over a period of time, I was very passionate about the idea of making sure that her life and what she lived wasn't something that somebody else could live, because HPV is preventable, it is treatable, and it's important that we have much more public awareness. And when I looked around, by around 2006, there was no other prominent registered charity in Canada that was doing work in this space. So I luckily, was able to found and preside over the organization, which is now called HPV Global Action. And we started to build different education that we do in academic settings, stemming from primary schools all the way through university settings, and then teaching healthcare providers how to communicate with their patients and with the public. And then it also extended out to sharing our best practices with other countries and other parts of the world, because the topic of HPV prevention, and cervical cancer and all of those issues is a little bit different all over the planet. So we're all at different places. So Canada has taken quite a good leadership role. And so our group has, as a result of this, been able to kind of share our best practices and really help different countries deal with some of the barriers to accomplishing some important targets, so that we can get at a place where we are eliminating cervical cancer and getting a handle on HPV. So in a nutshell, it's kind of snowballed into this, international organization with a very large team of people, luckily, that surround me. And it all really stemmed from a personal passion.
I always love hearing the personal story behind a movement like this. I mean, it's a personal experience and a tragedy that you transformed into doing something for the greater good. I lost 2 family members to cancer in the last half year, and it's really, it's opened my eyes. So when we're preparing for today's conversation, it was one that is close to my heart in many ways, right? So there's so many things we can talk about today. I have, the first topic is using behavior science to communicate messages that lead to behavior modification in people from grade 5 and up. So that is a very timely topic in today's context. Can Can we explore that? What are the key elements that our listeners should know around what you do around behavior science and how that applies to their own health outcomes?
Well, I think we have to be really clear about there's different kinds of people. There's people that are visual. There's people that, will follow a PowerPoint and they like to read along. There's people that are visual and they need to see, they're tactile. They want to see, give an example with, so I have always integrated different elements of me talking accompanied by a PowerPoint and also having props with me at all times, because in any given room, whether it's a grade 5 student or it's a mother or it's somebody that is a newly landed immigrant or has, English as a second language or any other language, there's always, different things that are happening in a room, their level of understanding, our mind is going a million miles a minute. I might say something and then they're not paying attention anymore. So we always have to integrate those elements into public health messages so that by the time we're done, they understand what it has to do with them first and foremost. And then what can we do about it? But it also means that we have to be clear in the steps that people have to take so that they can go out and actually have that behavior modification and act on that new information. And that really is, transcendent across all parts of our country, any country for that matter, and all ages. That if we talk to people here and they're here, it doesn't work. So, a perfect example of this is that we know for a fact that myth-based teaching is ineffective. We retain the myth and not the fact years later. So how many people in the teaching space would have to delete their PowerPoints from their computers right now if we were to remember that? We have a lot of hard evidence-based research that proves this fact. So, these are things when we talk about using behavior science to be really promoting public health messages, this is what we're talking about. And I'm in a space where day in and day out, I deal with, researchers and data and reading very high level complex papers. So we have to figure out a way to regurgitate that information to the general public in a meaningful way so that they can understand these important messages. So kind of brings me as it's the segue into the topic today, because HPV, human papillomavirus, tends to be a topic. Some of us have heard about it. Some of us have knowledge about it. Some of us are hearing things about it. And unfortunately, social media is ridden with a lot of information that's circulating, but not a lot of it is evidence-based. So the things that we're seeing on Facebook, articles that we're reading, if we're not making sure that we're reading things that are evidence-based, peer-reviewed information, we might be falling into an opinion piece and, get, taken away by big job titles of people and be persuaded to think that this is actual evidence-based information. So we're in a space where we're talking about something. You come into contact with HPV when you go below the waistline, when we're sexually active, either with our hands, with our mouths, or with other body parts between the waist and the knees, front to back. So already we're talking about something that people are, thinking, oh my gosh, now we're talking about something that's a sexual issue. So this could be something that creates a little bit of discomfort for some people. But I think, we've learned over time, we're getting good at this. It's 17 years later that we've been delivering vaccinations for HPV prevention, and we're delivering it in elementary schools and in high schools. And we stopped talking about it being something that we come into contact with when we're sexually active, and we've started talking about it as something that we could use as a cancer prevention tool, because HPV causes 9 different types of cancers. So who isn't up for cancer prevention, right? If we were to tomorrow have a vaccine to prevent us from getting breast cancer, we'd be lining up in the herds. But if I go back 20 years, having breast cancer was incredibly shameful. And it's taken us time to desexualize the breasts altogether. And now you can't even go put gas in your car without us seeing, a campaign about breast cancer. So we can see that with time and with education and awareness, taking these stigmas out of topics like HPV being something that is cancer creating. We need to more and more be looking at it like that, so that when we talk about HPV prevention through vaccination, first thing we have to understand is that the HPV vaccination is safe and effective. We've given over 300 million doses of vaccine around the world to date, and it's growing every day. And it's a cancer prevention tool, so that, we're preventing our loved ones, not just our children. This is good for people of all ages. It's a cancer prevention tool that it's best given as early as possible. So depending on what part of the country we live in, it's given in grade 4, some places grade 6, some places grade 8. We have different programs where we're offering the vaccination for free. I suggest the best place to go is our website, www.hpvglobalaction.org, and we have each province's vaccine programs and the eligibility for access to free vaccines. But even for somebody who's an adult, whether it be males, females, people with a cervix, people with a penis, this vaccine is available for everybody. And a lot of healthcare providers, insurance providers, are offering reimbursements for this vaccination that comes in 3 doses over 6 months for people over 14, and over 2 doses over 6 months for people under 14. And those programs for this cancer prevention tool are typically done, and it's coming up actually quite soon, that parents will be getting this opportunity to have access, to allow their children to have access to this vaccine through their schools. And most of the country starts sending home information about that at the beginning of October. And then they get the vaccine at school in October, and then they get it again in March. I think why it's such an important cancer prevention tool for people of all ages is that, it's causing tonsil cancer, vocal cord cancer, tongue cancer, throat cancer, anal cancer, cervical cancer, vulvar cancer, vaginal cancer, and penile cancer. And unfortunately, this virus can stay asleep in a person's body for up to 40 years before it wakes up and it starts being problematic. So this means that what we're doing in our early life could come back many years. So somebody could be sitting there listening today and being like, oh, I've been married for 30 years. This has nothing to do with me. Well, there is no age and there is no person that HPV that people can wash their hands and say, I'm sorry, this doesn't have anything to do with me. And because there's typically no signs and symptoms, and also because it's skin to skin contact, it means that condoms do not protect us from HPV completely. So as much as it's a great protection from unwanted pregnancies and sexually transmitted infections that, we can be protected from with a condom, HPV isn't one of them. So that opens up the list. And, oral sex, all these other types of ways of being sexually active make us come into contact with that. So we don't just have to have a penetrative sexual relationship with somebody to say, oh, okay, well, I've only had one partner. Well, you may have only had one partner that you will just say went all the way with, but have you had any partners that you had skin to skin contact with in your earlier life, maybe prior to a relationship? So this is why NACI, which is our National Advisory Committee on Immunization that oversees all immunizations and vaccinations across the country, they have not put an upper age limit on the HPV vaccination because of this fact that HPV prevention is something that all ages can benefit from.
Wow. Well, this brings me back to research I had done. I mentioned to you early on in my journalistic career, interviewing Dr. Steben, who works with you. And there are other diseases that condoms don't protect against, right? So HSV is one of them. And so I was very surprised because when we think about the education that we got growing up, we get certain messages, but then the reality can be very different when you're on the ground. So you talked about that. You may be thinking you're taking precautions, or you've taken precautions in the past, but actually haven't, and that could dictate your health trajectory in years to come. So when we think about our audience, mothers and some fathers, we have some fathers popping in of children. When are they going to be? You already talked about the next months being a time when people make decisions, but when are moments where people will be receiving information, like when they're thinking about their next visit to the doctor? We have a lot of our audience in Alberta as well, not just in other parts of the world too. But what are like 3 key takeaways that you may want people to have after listening to this today, especially given the current climate, right? There's so much talk about vaccination, and like it's a very emotional topic for many people, so the bandwidth may be limited. But if you could leave people with 1 or 3 action items that you would want them to take in their behavior and their conversations with their care providers, and how they're taking care of their own health and their children's and preventing risk, what would you like them to do based on the conversation today?
I definitely would suggest that they pay attention, first of all, to what's going on with the offer at school for the vaccination program. This is delivered across the entire country. Typically, it's offered at the same time as the hepatitis B vaccine. So when the parent gets this very thick, daunting brochure in their child's school bag, it's going to have, it's a public health leaflet. So of course, the language might be a little hard to understand, but you'll flip through it and you'll be like, oh, okay, so I have to consent to having the hepatitis B. Okay, sign, flip the page. Okay, I also have to consent to my son or my daughter getting the HPV vaccine, and they need to sign the page, and then they need to send it in. And because, so that's first, I would say. So that's coming up very, very soon. And people that are looking for more information, our organization is what we base ourselves on is providing evidence-based information at all times. If there had been information that was against vaccination, or that there were side effects that were very problematic, or whatever it could be on the negative side, I would have the duty to divulge that information on our website and here as well. And it simply doesn't exist. We still do not have any validated evidence-based research showing any negative side effects of HPV vaccination. So there's never a good reason for anybody to say, you know what, I'm going to wait. Well, it's already past 15 years we've been sitting around waiting. If anything, with time, we're getting to see the benefits of vaccination. So I would say people who want more information, you can come to our website. We have a long list of resources, number 1. Number 2, pay attention to this leaflet that they have to sign, because if they don't sign, the child will not benefit from vaccination. And if you have a physician yourself, a healthcare professional following you, when you go in to see them next time, be like, I would like to have the HPV vaccine. And there is no good reason that you need to have. It's not for a specific type of person. It doesn't matter if you've been promiscuous, or if you've been celibate, or if you're in a monogamous relationship, if you're someone who has sex with the same sex. There isn't a category that you're going to throw at me. Somebody who's had cancer, somebody who is a newly landed immigrant who's coming from another country. Every category could benefit from taking that moment and telling their healthcare professional, I would like to have this cancer prevention tool so that I can benefit from what the vaccine is going to do. Because we know that if you don't bring it up to your healthcare providers, they don't have time to go through a grocery list of things with you. So you really have to be very proactive and bring this up, because it's not something that's going to come up on its own. And then I would have to say it's spreading that message to your loved ones and being like, hey, are your kids vaccinated? Are you vaccinated? And, what some people will be like, oh, they were vaccinated. But through experience, that vaccine book that some of us have lost it, but a lot of us that have that vaccine book, we're not really sure what vaccines we've had. And so sometimes I'll be in an audience and doing an education piece, and they'll be like, oh, it'll be like it'll be like a 30-year-old male that'll be in the audience. Oh, I had that vaccine at school. No. And I say, no, you didn't. And we'll get into a back and forth. Like, we didn't even offer this vaccine until 2017 to boys. So if we do the math, you didn't get the vaccine at school. And in fact, and so a lot of people are surprised to see. So look at your vaccine books, look at your child's vaccine books. And then sometimes they'll have missed a dose at school. So it's to contact your healthcare provider and find out how you can get that missing dose, because we want to make sure that you're getting the full protection, because the first dose is giving you that initial protection. The second dose is giving you that extended protection. And we know right now that there's a minimum of 10 to 12 years of protection, which are really the big years for any human being of their sexual introduction. By our mid-20s, a lot of human beings have already done something below the waistline. They may not have had full sexual intercourse with another person, but they probably will have had some sort of skin-to-skin contact with another person. So that's why it's very important that when we have that offer at school, that we take it up. Now, the glitch has been COVID, because COVID has really made it that all around, not only North America, around the world, where we've been offering school-based programs, well, with school closures, it's been a little bit difficult. Right? Yeah. So that new question comes up, that depending on the province, and like I said, on our website, it shows each province the programs that are available. So let's say I'll talk about Quebec. It's grade 4. So last year, there was no vaccine program because there was no in school. Schools were closed. So I have, let's say my child is now 10, because you're 9 in grade 4. So I have a 10-year-old that missed their program last year through school. What do I do? So I would implore people to, first of all, we also have been posting on our website COVID updates, and how, not COVID per se, but how COVID has impacted vaccine programs. And then each Ministry of Health per province has updated their vaccine access. So currently in each province, because it's a new school year and we're heading into that vaccine time, they're saying, okay, like here in Quebec, I can go to my pharmacy now and I can get that dose for my child through the pharmacist, and I can book an appointment there, and I'll be able to get a vaccination there, or I can go to a walk-in clinic. So each province might be a little bit different, but I think vaccine eligible children for the past 2 years that have been impacted by COVID, because COVID hit, technically, we won't get into the specifics of when it actually hit, but we all heard about it in March. Well, that coincided with the second dose being offered at all schools in Canada. So none of the kids that were due for their second dose in the first part of COVID had access to that. So it's really going to be about parents and caregivers being motivated to seek out that information. Was my child eligible? Is my child eligible? Where can I get their vaccination? And we're all hoping, that what's happening with COVID right now, it's, in Alberta, we're all sitting here watching, and every province, our situations could be changing hourly in all of our provinces. So we could be looking at more school closures that are going to further impact the school-based programs. And just like so many other areas of our health, we have to really be empowered ourselves to seek out that information on our own. And we can't sit back and be complacent about it and say, oh, well, if it was important, I'm sure they would let us know. And unfortunately, that's not how this works at all.
Yeah, that's a lot to take in for sure. And that a lot of people listening to our show, often watching replays, they have very young children, even preschool age. Some of them have school age children, but this is planting the seed with them to have that reflection early on and start that awareness and conversation early on. Okay, so I would like to dive into a different part of your world, and that is being a mom, because you have children. And so you mentioned that I read your biography, you travel around the world. I don't know if that's on pause right now or not. Maybe it's more Zoom traveling, but how are you navigating being a working mom with a career that is, well, I'm sure that it's demanding with what you're doing, and there's probably a lot of stresses, a lot of changes going on right now. How are you staying sane and happy and joyful. Working, you work on a topic that often brings up like sad and difficult emotions, right? And you probably see things that could have been prevented, and you're probably heartbroken from time to time, and more often than you would like. So how do you navigate the world of being a working mom and being the working mom you want to be?
So I think, today it's funny in retrospect being asked that question, because my daughter is now 24, my son's 21. And I started this off when my children were very little. My son was 3, my daughter was 6 when I kicked everything up. And I remember, some of the keys that I have my mom is my best friend. She was always, behind me, guiding me. She's a teacher herself, my mom. And she always said, your first 3 minutes when you see your child in the morning, your second 3 minutes that you see your child after school, and your last 3 minutes when you say goodnight to them, be fully present. And that was always, that means like your phone's not there, and you're literally giving your 100% dedication. So, I mean, when we're thinking about time, and we're always under time constraints, that's 9 minutes of your day. 9 minutes of your day. We all have 9 minutes, and we're not even asking for that. 3 different time points of our day. And I remember always looking to have that kind of a balance that, as much as I had to really throw myself into work, it was also showing my children to follow their passions. And they understood, where this passion came from. And I think that them seeing that really helped them kind of support, my career, if you will.
Yeah.
And I think, now when I look back and I see them, my son's in university, my daughter is about to become a registered nurse, and they're living their passions. They're both doing what they want to be doing. So I'm thinking to myself, okay, I was successful in making sure that they follow their passions, but I still have that same rule where I'm always trying to have that type of balance where even if I have no time in my day, I want to make sure that I give them those 9 minutes through 3 different times of my day at all times. And sometimes, that's all we can do, because we all have such a different variety of jobs and time. Like some of us have 12-hour shifts. Some of us, we only see our children in passing. Some of us have to talk to our kids half the week over Zoom or Messenger or whatever. And I mean, that's sometimes my case as well. I just know that when they see you staring at them and you're engaging in what they're saying, that in itself, we all like to be paid attention to when we're talking. We don't like when people are like, oh yeah, I'm on my phone, and yeah. It's like you don't feel like you're important. And that's always been something that's been critical to me in sporting events. I've always bent over backwards to make sure I was there as much as possible. But I also haven't been too hard on myself, because I've always had it every day that I wake up, I'm doing the best I can. We could all, beat ourselves up over, oh, I wish I had done this, or you compare yourself to other parents. But honestly, I haven't bothered trying to do that to myself, because I know that I've always been trying to do my best. And I think it's helped that I love my work. And I think that also can be a different situation for a lot of people, is like, if you don't love your work, and especially with COVID, I can tell you through my colleagues that are working in clinical spaces, and the psychological impact and demands that are happening to the parents. I never had to deal with teaching my child math at the table while I tried to navigate my own work scenario. So I can only imagine. But that technique of coping, you can't teach that at school. So coping with life on life's terms is also something that I'm still to this day, sometimes life is tough. It's hard right now, but you know what? Let's look at the basics. We have each other.
Yeah.
We have food in the fridge or whatever it might be. And I think that's also helped mitigate a little bit of the complaining and the hardness of this COVID era that we're in. But it's definitely a challenge, and I thought I was people are like, oh, you'll be done at 18 or 19. I mean, you're not, I'm still not done. I'm still, it just evolves. What you dealt with at 2, you still deal with when they're older. So I've kind of just tried to carry through with those same keys through and through. And so far, it's made it that I'm really close with my kids. And yeah, so I don't know if anybody takes anything from that a message, but I can say, we're never really as alone as we think we are dealing with stuff. I think we don't necessarily talk about all the things that we find hard, balancing work and childhood years. And, there's no book on parenting. Well, there are some, but, there's no crash course on being the best parent 101. So I think we're all doing the best we can. And I think that's why shows like the one you have are really great tools for busy parents, so they can pick up on some tips from time to time. So I'm grateful for finding you so that we can be a part of it.
I love the 333 tip. It's so manageable and actionable. It's been a time where people had to reinvent their world and their boundaries. Even myself, I've been generally working from home for 2 years, and I got a sense where I kind of had enough. So I found a solution to be able to work outside of home too for my work. But yeah, you can be glued to your phone all the time. It's highly addictive. We seek those little adrenaline rushes from the notifications and the messages. And so that idea of like the first 3 minutes and then, after school and at night, it's just very, very concrete. And obviously it can be more than 3 minutes, but that kind of starting point of that and throughout the day and different ways of connecting. I know that I love to snuggle with my sons in the morning. Like I don't miss that. And I still nurse my youngest, who's 2. And then I try to, as much as possible, sometimes I have obligations in the evening, but I try to very rarely skip the evening snuggles, right? And just kind of holding my sons and realizing how important they are and how grateful I am to have them and to be alive, to experience being a mother, right? To experience loving them and the thick and thin of things. So thank you so much, Teresa. I'm looking at our questions. It's getting time to wrap up. Is there anything else that we haven't touched upon today that you would really like for people to take away regarding prevention? Having access to this really preventable tool, questions, stickies you want. I always talk about putting stickies on your wall to remember what's important. So is there one last message that you would love to impart?
I won't get into a new topic, and I would just say I would really promote that people that are seeking questions, they have concerns, they want evidence, they want new information, they want further explanations, visit our website. Our information is in 12 languages. We're into our 13th now. So we are really trying to be very broad in who we reach. So I implore people to go to www.hpvglobalaction.org. And on this topic, I think, it's such a heavily charged topic, like you've seen. Yes. I think that, if we've incited interest and more curiosity, and you want specific information for you, your families, no matter where you live in Canada, we can definitely provide that information to you. And I think that's my big takeaway for today, because I think it can be difficult to know where to go get good evidence-based information. And we are only working with evidence-based information and what is being offered by public health across Canada. So it's not our own personal biases that are integrated into our information that we provide. So I think that's my big takeaway for today.
Okay. Well, thank you so much for your time. I will see you backstage to thank you personally. And I hope that this interview will spur people into action, getting the information they need to protect themselves and their families. Thank you, Teresa.